Yo, I'm Ches and this is my son Vinny. This is Vincent. Having a little sleep in my top. So I'm filming this mainly for little baby for when he's like 18, to show at his wedding to embarrass him, but also kind of for me to remember how his birth went down. And when I was leading up to his birth, I watched a lot of positive birth stories because there's a lot of fear mongering out there, and I found them incredibly reassuring. And I'm a big believer in knowledge is power, so I'm going to sort of explain to you everything that I went through and everything that was scary and everything that was actually not scary. And the title sort of says a nutshell what my journey was, so that hopefully you can go into your birth feeling really positive as well. And Vinny, we're going to find out a little bit more about how you came to be. So this was our second pregnancy. Unfortunately, we lost our first, so I was pregnant for just under 8 weeks, so we didn't have a scan or anything yet, and then we miscarried. And looking back at it now, it still does make me feel a bit emotional. I was not very brave at all. I know lots of people, and probably people will end up watching this that have had much worse journeys than that, but that doesn't diminish my journey. I think I found miscarriage one of the most traumatic things in my life, actually, and I've had lots of ups and downs and lots of twists and turns in my life, and miscarriage was definitely up there. It took us to get pregnant with that first child. It took us maybe like 4 or 5 months, which felt long. I'm quite controlling, and I found that difficult because I'm quite fit and healthy where I am at the moment. I'll probably look back at this when I'm 50 and fat and think, oh God, wow, I was fit and healthy and I ran marathons. But yes, at the time I was fit and healthy, and I just presumed it would be easy for us. My husband was fit and healthy as well, and we're A-type people and we're go-getters, and we just kind of were brought up on the ethos that if you work hard enough at something, you get what you want, and that doesn't actually work with pregnancy. So that was a bit of a shock. And then what was more frustrating is it took us a long time, not a long time compared to some people, but seemingly a long time to get pregnant again afterwards. It took a while for my body to work out what had happened and how to recover and how to get pregnant and stay pregnant. So we used OPKs at first, which are ovulation sticks. So you pee on the stick every morning to tell you when you're ovulating. Now they were good, and that's how I got pregnant the first time as well. Actually, the first month that I used them is when I got pregnant. And then they weren't working so well the second time. They did highlight that I wasn't ovulating at first. I think if you have a period, you are ovulating, but either way, it wasn't coming up as the peak day with the smiley face, and that was very traumatic and upsetting at the time. But I think my body was just working out the miscarriage and sorting itself out. So I had 2 really slightly long cycles, quite normal, and then 1 really short one of 16, 17 days or something. So obviously that was my body resetting itself. And by that point, I'd also started using the temperature thing, basal, honey, what's it called?
Basal body temperature.
Basal body temperature. And the reason why I started using both alongside each other is because you with the OPKs, yes, you get the smiley face, but you could peak, and so it automatically gives you the 2 smiley faces, and actually your ovulation window could be really small, which I think I worked out that that's what was the case with us. Whereas the body temperature thing is a bit more predictable. You take it on the day that you've essentially ovulated on your OPKs, you take your temperature in the morning and the evening. So it might say that actually you had your dip or whatever in the evening, and your window of opportunity was very small. So just TMI, sorry Vinny if you're watching this when you're 18, but Daddy and I made sweet love on the morning, which is what got me pregnant. So I think by the evening, it had already gone through my system, so I had an 8-hour window of ovulating before it was game over. I also went down the line of holistic-y stuff, so I had reflexology, which I just loved because maybe it was just the person that I had. She was absolutely wonderful. She was almost like a therapist at the same time, and I was far too stubborn to have therapy, which is really silly, I know, but maybe that's the way I've been brought up. I probably should have. She was like a sort of undercover therapist whilst rubbing my feet, and that was really lovely. And I also had a dear friend that was a nutritionist, and I sort of took control of my diet, and I definitely cut down on booze. I was quite a drinker. The nutritionist went through a lot of things and sort of seed cycling and stuff, and eating the right kind of thing when you're ovulating, and just taking care of my body basically, which just with me, it just made me feel like I was in control. I mean, I'm not sure how much of it led to Vinny, but I definitely felt like I was taking control of the situation, which is what I needed, and that worked for my head. And the same with my husband as well. He was very supportive of all this stuff. He wasn't like, yeah, okay, whatever crazy thing you want to do. He was totally on board with anything I wanted to do, to feel like we were heading towards our baby. I'm getting emotional already. We haven't even done your birth bit. Oh dear. Okay, so yeah, also in the title I put he is Breech. So I'll just tell a quick thing about how we found that out, because that should be a warning to anyone. Is with the NHS, I'm not sure what it's like if anyone's watching this abroad, but with the NHS, some hospitals scan you as little as possible. And I think it's just that scans are really expensive for the NHS. We didn't get the 36-week scan, which I know some hospitals do. I had a bit of mum instinct. I just felt like I wanted that final scan, just to check that he was head down. All the midwives' appointments, they'd been feeling him and measuring him for weeks. I must have had about 4 or 5 entries in my book that said, yeah, baby's head down, all is well. And you can see where this is going. We got a private scan, and I had to convince my husband, because I would think it's about 100 quid. He was like, really? Like, we've had a really healthy pregnancy. And I should say that as well. I was so lucky in my pregnancy. I didn't have morning sickness. I didn't have cankles. I didn't have any kind of blood pressure stuff. Everything just went hunky-dory. I felt perfectly normal, and I was running still at 8 months. I only stopped running because I thought maybe I was buggering up my pelvic floor permanently, and I'd be peeing myself every time I sneezed, so that's why I stopped. Actually, I felt fine. So easiest pregnancy ever, which was also slightly disconcerting. Having had a miscarriage, you kind of want to feel something, and I didn't show until 3rd trimester really, as well. So it was actually a bit disconcerting. But yeah, don't look a gift horse in the mouth. I had a great pregnancy. It was fabulous. Yeah. Anyway, I convinced my husband to get this extra scan, and lo and behold, at 37 weeks, we left it quite late because we thought all they'd do is go, yeah, your baby's fine. We found out he was Breech, and big, because he'd obviously been Breech a long time, and his head had plenty of space to expand rather than being in my pelvis. And by the time we got to see a midwife again, we were kind of 37 and 2 days or something like that, and it was quite fortunate. There was a Breech specialist midwife in the hospital at the time, and she was wonderful and very supportive, and talked me through it all and all my options. But essentially the safest thing for him really was a C-section, which when we'd kind of done all our birth plan and things, I just hadn't occurred to me that a C-section would be a thing. Like, I guess I'd read very vaguely about it, and very late in the pregnancy as well. At some point I was like, I suppose I should probably read about this just in case of an emergency C-section. But I just, again, arrogantly, like with the pregnancy, I just thought I'd just get pregnant. I arrogantly just thought the birth would be fine because I'm fit and I'm determined, and I was like, yeah, it's my womanly right to give birth, and I'm not going to make a fuss, and I won't need an epidural. Hey, I'm hardcore, you know. And actually, I got bitten up the bum for that. Yeah, she talked through options of breech birth, and she was sort of not trying to convince me, but she was like, you're a good candidate, you're healthy and whatever. But I thought about doing it, and I think I realised that I was only going to be doing it for my own vanity and not for Vinny, because actually the risks were higher for him than me, really. We tried an ECV, we tried to flip him, and it was far too late. By that point, his butt was firmly engaged in my pelvis, and his head was well wedged in my sternum, and his head was big, and he wasn't going anywhere. And it was actually just quite a painful experience for me, and probably quite unpleasant for him. We had to go down the C-section line. I was quite emotional getting my head around that, because I never even took headache pills. Well, still don't. So the idea of having kind of major surgery was just very disorientating for me. The only time I'd ever been in a hospital was for these midwife checks, full of hormones and stuff. My poor husband had to do a lot of looking after me when I was very emotional about that. And then there was a lot of back and forth about dates as well, because all the women in my family give birth early. So originally there weren't any appointments because it's all a bit last minute. Well, a lot last minute actually. Normally if you've got a breech baby, they will pretty much book you in as early as kind of 32, 34 weeks, I think. They'll start saying, okay, let's book in that C-section just in case. 2 days before, I saw a nurse who took some bloods. By this point, you're probably quite used to having bloods. I had to have the gestational diabetes one as well, where they take a load of bars at the beginning. I hate having my blood taken. I really, really hate it. So that in itself is just really rough for me. They take some bloods, I think, to check your iron levels. So they do a comparison afterwards, and depending on how much blood you've lost and things. Yes, this is 2020 and COVID is still kicking about. It's not as rife as it was when it started in kind of April. My poor stepsister gave birth in April, and it was a very difficult experience for her to do a COVID test beforehand. And at the time, it was sort of a kind of gagging swab at the back of your throat, which actually wasn't so bad, but then one up your nose, which I hated. Oh my God, it was horrid, utterly horrid. So the COVID test was way worse than actually most of the rest of the procedure. I think I hated the COVID test the most because I didn't know what to expect. So if anyone watches this and is about to go in and COVID is still present, then you're going to have a COVID test. Heads up, that sucks. I didn't know what was involved in a COVID test, and it took me by surprise. You have to take your jewellery off, so if you've got a wedding ring that's quite wedged on, they were actually quite good with me. They let me keep my wedding ring on, but some hospitals are really funny about that. We did have to wear masks at my hospital, and then they let me take it off, I think. They let me take it off in the postnatal ward. Yeah, I think I'll come back to that later on my bullet points. But yeah, we did have to wear masks, and it sucked a bit. My husband had to wear a mask the whole time, but he's not having a baby, so suck it up, buddy. So they don't let you eat and drink, which was horrible. I love my food, and I think you have with NHS anyway. You had a big meal the night before, and then your last snack at midnight. So I think I went to bed and then actually set an alarm just to eat. Yes, I did. I had snacks by the bed. Went to bed early because we had to be in the hospital by 7. And again, with the NHS, you don't have time because they prioritise all the emergencies, obviously. And you just go in, and there's however many of you lined up to have your planned C-sections, and they just kind of whiz you through when they can. I got to take some anti-sickness drugs the night before and on the morning, just so you're aware it wasn't anything scary. Hello, buddy. You're getting more comfy. Don't be sick on me. Don't be sick on Mummy. Mummy loves you. She doesn't want to be sick on you. Okay, Papa? Okay, so we considered moving the baby. He was not up for it. He is quite happy in his little cocoon. If anyone's wondering, this is a top from a brand called Serafina, and they're called skin to skin tops. I've got a couple of them, and in the first week I just lived in this. I actually haven't got it out again, but I just got it out for the video because I knew he'd be lovely and calm in this, and I quite wanted him to be in it, so that when you're 18, we're going to show you this and embarrass you. So actually we didn't get seen until 11ish, I think. So I hadn't drunk anything from 6 a.m. to 11. And when you're pregnant, you're really thirsty all the time. So that was quite grotty. So as a recommendation, I'd say bring some gum. They let me chew gum, and that was a bit of a lifesaver. And bring crap TV to watch, because you're quite apprehensive beforehand. So you can't focus on anything decent. You're not going to read a book. Like, we watched The Simpsons, it was great. Yeah. Surgeons came through and introduced themselves, which was really nice. And they sat like at a table where I could see them like across the room, and were quite noticeably looking through all my notes, which was really reassuring because my birth plan was in there and stuff, and had to redo my birth plan to work with C-section. And they really actually did look at it all and take it into account, which was really lovely. Yeah, so then we were in our waiting room, and they bring you scrubs through, and they give you some compression socks, and that's something I didn't really know about, because maybe I had looked it up. No, I don't think I knew about it. I think when we got home we sorted that out. So you might want to, if you've got some flight socks at home, you might want to give them a wash, and make sure you've got some handy, because they only give you one pair of these compression socks, and you're supposed to wear them for like a good week. I think I wore them for even longer because it was unclear when I was supposed to take them off. I think you can basically take them off when the swelling goes down. We'll talk about the swelling later. So for a breech as well, I think this is pretty standard practice. They give you a quick scan just to check that they are still breech. Now, I'm not really sure what that scan's supposed to do, because had they said, oh, he's flipped, what the hell are you going to do? Like, are you going to walk away knowing that you were supposed to have your baby that day, and then walk away not knowing what you're going into, because you could then go into labour, yada, 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 and then end up with an emergency C-section for one reason or another anyway. So the room itself, this is something that I came across in a lot of the videos when I was watching C-sections, is knowing what you're walking into. Sometimes you can ask to see the room beforehand, but during COVID you certainly couldn't. I thought it was going to be really cold. A lot of people said it was really cold in there. So I brought like a really warm cardigan, and it was in summer in London, and it was a hot summer as well. So I like cooked myself beforehand, so that actually when I walked into that room, it would feel refreshing for me. Like, oh, okay, I needed some cool air. And actually it wasn't that cold for me. So I was like, oh, I'm still really hot. But yeah, I've been told that some of them are really cold. They keep the temperature down for hygiene reasons. It's very bright in there. Something else to take into account, like so I think some people put on their birth plan they want it to be dimmed lights. I wouldn't have wanted that. Like, I want everyone to see what the frick they're doing. But even if it is dim lights, I think one of the girls in my group who had a C-section said she requested that, and then they actually do brighten it up for the cutting and the whatever else, so it's like a bit pointless. So don't bother with that on your birth plan, it's a bit pointless. But you can have your own music. That was really lovely. I think they're all a bit busy and stuff, so my husband did actually flag it. So you might need to say, even if it's on your birth plan and they've read it, like, you know, they're kind of doing their job and keeping you and baby alive. So if you want your own music and that's going to be calming, then maybe get your birth partner to flag that. Because we pretty much put it on straight away. They're a bit funny about the volume. I'm a musician, so I wanted to really be able to hear it. Oh, hello, wakey baby. Should we let your head out? Your little tiny head and his little furry hair. Oh, you're so perfect. So yeah, so I would have liked it a bit louder, but obviously they need to kind of hear what they're doing, which is fair enough, but it is quite quiet. So take that into account with your playlist. If you're wanting a really upbeat playlist, it's going to be quite backgroundy and quiet, so you might want to go for chilled out stuff. I did hypnobirthing courses. I wasn't amazingly on board with it. I know some people are huge believers and they say it's really helpful for C-section as well. I did well, before the end of my pregnancy, I did a lot of yoga, so I was kind of quite into breathing stuff, and that rings, you know, marries in with hypnobirthing. So the breathing stuff does keep you calm. I'm into that. I believe in that. But other than that, it wasn't amazingly helpful. But yeah, I had nice relaxing music. I know some hypnobirthing people might want to play their swooshy ocean waves and things like that. Would be quite nice. What I did find is I got quite overwhelmed. So when I went in on my own. My husband couldn't come in with me, and I don't know if that's the case outside of COVID. He came in very shortly afterwards, but just when I went in on my own, and they gave me a sickness jab, which is like small fry really, it's just the beginning, but for some reason even that jab was in my arm and it's quite an ouchy one. Something got me a little bit overwhelmed by that. I think because I'd been kind of joking around, we'd watched The Simpsons, whatever, I'd made myself too hot, and then suddenly we were going through. And I did start to feel a bit like, whoa, and it wasn't the sickness jab that made me feel woo, it was just feeling a bit overwhelmed. And then the anaesthetist sort of cracked a little joke or something, and I instantly felt better. And then my husband was sort of somebody in the room with me, and I like mouthed over to him, I was like, make them talk, because I worked out that chatting and taking myself somewhere else worked for me. Like I've said to a couple of people, I definitely wasn't quite 100% there. Like I'd gone into, you know, like I said, I'm a musician for a living, like I'd gone into performer mode. So I remember when the surgeon was like chatting through like how it was going to work and stuff in our little meeting beforehand, and I was just looking at him and thinking, you're a surgeon, how do you have time to work out? And he had such lovely arms. How do you have time to work out? You're a surgeon. So I wasn't quite all there. I think I wasn't quite taking into account what was about to happen. Hello, monkey. Are you comfy? Yes? Skin to skin? Okay. Vinny's a month old today, by the way. That's what prompted me to want to do this video. You're a whole month old today. It's gone by so quick. I can't believe it. I want you to stay small forever, please. IV fluid. For some reason I had the heebie-jeebies about the IV fluid beforehand. I'm quite icky about wrists and veins. that went into the back of my wrist, didn't go into my hand, just if anyone feels funny about this as well. And you can see them right by you, these drip things. There's quite a sort of franticness about that. She was changing stuff on that quite a lot. That's something no one ever mentioned in the video that I would have liked to have known. One of the other things I'd said as they were hooking me up, I was like, I want to have a hand free for hopefully when we get skin to skin afterwards. And she was like, oh, you can use both your hands, even the one with the IV. So for some reason I think maybe in America or something, they put your arms outwards like a sort of angel. Oh, operate on me. Whereas in the UK I could just have them across me, which actually, that felt much more reassuring than the idea of being pinned outwards. So I had one hand that had nothing going on and one that had the IV and the clippy thing. I'm not even sure what that does, which reminds me, you can't have any nail varnish or anything either. You know what the clippy thing? Heart rate monitor. There we go, husband knows. You can't have any nail varnish or anything on because that affects that as well. But toenail varnish, I guess is fine. I mean, I had toenail varnish on. The spinal tap. So presuming you've got a planned C-section, they'll do a spinal tap. That's the injection rather than something that's permanently there, which I felt much better for me than the idea of having something stuck in my back. That was fine. It was really fine. So yeah, they had me sort of bend over. I think they gave me maybe a pillow or something to lean over, or maybe I was just leaning over. So I brought my knees up and I had to lean over my knees. God, it's all gone already. You kind of block these things out. And then I felt like a scratch, like you would any kind of, like any kind of injection or blood's being taken. It's just a bit like, meh. It's not painful. So I don't know if I got lucky because I know sometimes they can take a couple of goes, and she did it first time. She was great. What I did find a bit disconcerting is the numbness went down one side first. And again, no one had mentioned this in any videos before, but I lost feeling on one side and not the other. So when she's doing this cold water test, I think some people do a scratch or something. With mine, they did a cold water, so they did it up by my neck and they said, you can feel that, can't you? And I was like, yeah, I can feel the change in temperature. And she's like, can you feel it here? And down by my feet, I couldn't feel anything or whatever. But I could on my right side and not my left. And she was totally calm. I was like, yep, that's normal. But it did take quite a while for the other side to go. So another thing I got funny about was the catheter. I really didn't like the idea of anyone fishing around down there, which seems a bit ironic because, if I'd had my beautiful natural water birth that I'd wanted, people would have been down there a lot. Like I never even had a check, down there. So no one's really been down there except my husband. Sorry, Vinny. Again, this is going to make you cringe so much if you ever watch this. Okay, so yes, the catheter thing freaked me out a little bit, but they do it when you're already numb. She said, I'm going to put your catheter in now, and I was like, okay. And then I couldn't feel anything, and maybe I could feel some sort of like movement around, it was absolutely fine basically. And also having that taken out later, they take it out, I think it's like 12 hours later, it was like the next morning they took it out. It just feels like, for want of a better way of describing it, it just feels like someone's kind of taking out a tampon kind of feeling, like it's just like, ooh, slide and it's gone, like a second. So again, that wasn't worth getting myself in a fuss about. It was fine. One thing that was a bit weird, they do like a roll call, so they say everyone that's in the room, including me, to like present. For some reason I found that really intimidating because they were all joking around. Like I said, I'd said that I liked the chat, and then there was loads of joking and mucking about, and then all of a sudden it got really serious and everyone's like, yes, midwife present, yes, surgeon number 1 present. That freaked me out a little bit, so maybe it's useful for someone else to know that that's going to happen. I was like, oh my god, it's really happening. Lots of people get shakes or sickness. I didn't get that. I was really lucky, so that's good. I didn't get any, but it's worth warning you if you're watching this and this is, you haven't heard of that. I think a lot of people get like quite frantic shakes, and that can go on for hours afterwards, but that's perfectly normal, so don't freak out, especially the room's cold and it's all, you've got heightened sense of emotion in there as well, or it can lead to sickness, so that you have to shout and let the anaesthetist know if you're feeling sick, because some people are sick during it. I wasn't, luckily. Oh, hey buddy, hey little buddy, are you having a nice snooze in there? We'll stay there for a little bit longer while I tell you a story. So in terms of what I could feel, I could feel kind of like pushing, I would say. You can feel people, you can feel your body being moved about, like they're quite forthright with you. I could feel being bumped about, but you can't actually feel anything. You're not going to feel any kind of pain. There's no pain whatsoever. So I would say all the prep stuff took 15 minutes from the time I was in the room to when they kind of got cracking. Not really much more than that. And then actual first incision, which they don't tell you, that seems to be a common theme. They don't tell you when they start. There must be a reason for that, psychological reason for that. From that to Vinny being out was like 5 minutes. It's so quick. Before I knew it, they were saying, "Dad, get your camera ready," and I was like, "Oh." Well, in fact, again, I was in a little bit in a different zone because I remember thinking, "Oh, good, he's about to be born. That means I can have a drink because I'm really thirsty." And that's what went through my head. I said, "My son is about to appear." I was just like, I'm so thirsty. So glad this is nearly over. So yeah, I'd obviously taken myself to a slightly different place. Other things that went on before he was born that might be worth mentioning. They did at one point go, "Okay, so the cord is around his neck." They weren't telling me, they were telling each other. If you hear something about the cord being around their neck, they're not breathing yet, so it's no big deal. It just depends how they're going to push them out, because the cord's shorter if it's around their neck. Like, you know, I think that it's more to do with that. And funnily enough, when I'd had that scan, whenever 38 weeks or something, when I'd had another scan at the hospital, I had scans. They did look into that and it was fine, so it must have happened afterwards. But yeah, so that's not something to panic about if you hear them say something about that. Also, I wasn't prepared for them to come quite so the screen is up by your boobs, basically. And the surgeon, because his head was right up in my sternum, one of the surgeons was right up by me, pushing him down. So I thought I would not see anything. I wouldn't see any of the surgeons or anything. I'd have the screen up, happy days, you just go do your thing behind there and then give me my child. And actually he was like right up in my grill, man, like pushing Vinny down, which is, you know, slightly intimidating. Then we had the get your camera ready moment. If you're funny about Dad cutting the cord, it might be, sorry to burst your bubble, but it doesn't really happen in a C-section, and the whole waiting till the cord stops pumping thing, like, just be sensible. So you are cut open and they really don't want to leave you open for any length of time. So I think they give it like a maximum of a minute, like they try and be respectful about the whole delayed cord clamping thing. But equally, you are open and there's bacteria everywhere in the air. You know, we're living in a time of COVID. Close up that wound, like sod the bloody cord. And also with the cutting thing, they have to cut it. They're not letting Dad down that end. So they cut it, and then they said to Alex after, so he goes over to, they give him a little clean up quickly, and then he was on my chest before I knew it, but went to have his clean up, and they said, "Dad, would you like to cut the cord?" And I already knew from one of our other mums that had already had a C-section in my group that you don't really cut the cord, you trim the cord. So, I mean, you could do it if it means a lot to you, but you're not like cutting mum from baby, if you see what I mean. That's already been done already. So, you know, if you feel like that's a nice moment for Dad, you could do it, but I thought it was just a bit gross, like cutting through meat. So I told him not to. I thought that was weird. Right, what else? Well, yeah, I'd read somewhere that you're supposed to bring your own towels and rub them in mum's smell and mum's micro whatevers. So we brought some towels and they were like, no, they were a bit funny about that. Which is kind of fair enough. I think hygiene wise, they want to use their own towels. So that didn't work out. So don't bother bringing your own towels. It's unlikely the hospital is going to let you use them. So they gave him a little clean up, which Dad was allowed to go to, and they were really good actually, strategically about where they placed it. I could see that, because obviously you've got limited mobility, you've got kind of your arms and your head, but you're lying flat down, in fact maybe even head slightly back, but they'd left a line of vision. No one was really crossing that path, so I could see my baby and I could see that he was good, and I could see Daddy over there, and all was good. So yeah, so skin to skin, I was ready to just, because I thought, God, if you're lying flat down and you've only got sort of this area upwards, I thought it might be a bit awkward skin to skin. So I kind of prepared myself to say, like, this isn't working, let's just give him to Dad. And Alex was wearing a shirt, so he could just unbutton quickly. Which also, bring a change of shirt in case you get meconium or whatever blood and crap all down you. So I know it's all about mum, but Dad, do bring a change of clothes, or you could get immediately peed on or whatever else. But yes, they put Vinny on me, and actually it was beautiful. It was a beautiful, beautiful moment. So yeah, and then they stitch you up while you're skin to skin. Hey, Chris, are you enjoying the story? Yeah, I think also I didn't necessarily get that immediate rush of love. that some people talk about. I wasn't like, my baby. It was, to be honest, it was a little bit weird. I almost felt like, I remember sitting, like, looking at him, his little eyes were looking right at me, obviously in the photo I coloured in. Like, I remember just like saying, I'm your mummy, being like, are you my baby, or do I need to give you back at some point? Like, it was just a bit surreal. I mean, obviously I'm completely besotted now. I didn't have like a weird kind of, I'm not bonding, but just to prepare yourself, not everyone gets that immediate like, moment. And I think probably even less so with a C-section because your body's not been through it, maybe, I don't know, but it was beautiful. Like, I think our birth was amazing. But yeah, I didn't necessarily get that rush of emotion. And then the stitching up. Hey Benji, are you vocalising? The stitching up only took like 20 minutes. They were super quick. A slightly indignant moment where luckily none of the men were in the room. This was probably just my birth in particular. But Dad went off with baby to have a little clean up and be weighed and whatever else and have a cuddle. And I had to get moved to the bed that then gets wheeled through to recovery. And obviously you are completely immobile. So we had like 4 or 5 women have to sort of hoik me onto this bed, which I don't know, like really giving birth is not the time to be prudish, but I felt a bit funny about that. I was like, oh no, like I want to help, but I'm completely immobile. Right, so recovery stuff. This is important because this is what I was really fearful about, and actually the recovery was fine. So I'll talk about like the recovery room and what happened immediately afterwards, and then how I got on postnatally. Before we went to the postnatal ward, we went to a recovery room. Oh yeah, because this is quite interesting. So we went to the recovery room and you get checked a lot there. There's a lot of attention on you to see what's what, and a midwife helped us with his first latch, and he did a brilliant job, especially because he was tongue-tied, which you could see from his first screen. He was very tongue-tied. And he had a great latch still, and he did a great job. You came out having read the manual, didn't you, Baba? He was such a good baby. So they give you a hand with that, and literally be prepared for them to grab your nipple and shove it in his mouth. Like, it's quite intrusive. But that was great. And yeah, had these little sips of water. I think we were meant to be there, in my hospital we were meant to be there for 4 to 6 hours, they said, but I think we were only there more like 2 or 3. And they brought me some tea and toast, which, you know, actually I can't really eat. Some people say they're so hungry after a C-section, it's the best toast they've ever tasted. I just remember it being a bit sticky and sticking to my mouth and not really wanting it. I don't think I finished it. And I wasn't feeling sick as such, but then all of a sudden they were like, okay, so you're fine, so we're going to move you. And I was like, oh, okay. And I went to kind of try and get myself up, and I was like, oh, I'm not sure actually. And they were like, and I knew it hadn't been like 4 or 6 hours, and I think I kind of got the impression they looked at me, thought, oh yeah, she's got everything under control, we'll move her. And I was trying to say to them, oh, I'm not sure I'm ready to move actually. And I'm no shrinking violet, like I wouldn't have wanted to come across like a pansy. And she was like, okay, well, she went out and then came back in again and was like, no, we need to move you. So I think they must have had an emergency scene or something that needed to come in. They needed the bed, basically, and I was the best of a bad bunch. That they were like, well, if one of you's got to move and she looks all right. So I had to get in that wheelchair, and I remember just being like, oh my God, I can't do this, and getting myself into that wheelchair. And then one of the things that I would say was essential on our list was a handheld fan, which actually we've got a clip one, so that now fits onto his buggy, which is handy when it's hot as well. And I felt rough. Oh, I had this fan, I just had my eyes closed and just concentrating on not being sick, don't be sick, don't be sick, don't be sick. Because if I was sick, we were like on the move. I was like, I'm going to be sick in the hallway. This is horrific. So that made me feel sick, was getting up and getting into this wheelchair. And then they got me into the bed in the postnatal. And I said, I think I said to Alex, I was like, Alex, I feel good, man. So he went and flagged on the midwife side. My wife doesn't feel very well, and they said, we'll give her another boost of an anti-sickness jab. So came in and jabbed me, and that was when I was sick. So I was like, oh, what? So it was horrible. But I think it was just literally having just been moved, and I think I went to try and get up to go to the loo or something. I tried to move myself, and that made me sick. And then I was worried that I was allergic to something they'd given me, and I made Alex go and tell the midwife that I'd been sick, having just had this jab. And they were like, nah, she's fine, it's just just major surgery, that's all. So heads up with that. I did get sick later on, but it wasn't a big deal. It was just, I remember like chatting to him whilst being sick, like again in this other place. I was like, you should tell the midwife that I've just been sick after having a jab. And he was like, okay, but you're okay? And I was like, go tell the midwife. Like, anyway. So recovery room itself, I'd been a bit funny about. I was really desperate to get a private room, and I was willing to throw any amount of money at it. During COVID as well, my husband couldn't stay overnight. He was there. He was allowed there 8 till 8, and actually, currently, some hospitals it's less than that still. Ours was quite good. So yeah, and I think they were really sweet actually. I think he was still there at kind of 8:45. He was there a good 45 minutes before they really kicked him out, and they were so polite about it still, even though we massively pushed boundaries. So the recovery room wasn't as bad as I thought. We tried for a private room and there actually wasn't availability. Various celebrities had them. So that was a blessing in disguise. It was going to be bloody expensive, and the recovery room was fine. I think I was quite lucky. So it's all curtained round, so you feel like you do have your own room. I thought for some reason I had in my head beds and beds of mums all next to each other and screaming babies and whatever else. Like, you can't see anyone else. You have got your private space. Obviously it's just a curtain, so you can hear other people. I was fortunate. I had one mum who, I think she must have had an emergency C-section. She was certainly quite traumatised by everything, and she was very upset and got herself in the right tears and was having problems feeding. So eventually she just asked for them to take the baby away and go feed her some formula. She didn't want to do it. So they said, look, should we just give you a break and we'll just take your baby away for a good, and you can have a good sleep and recover. So they took her baby away for like 4 hours or so and just went and dealt with that. So that was one down. And then there was only one person next to me, and her baby was very jaundiced, and jaundiced babies are often really sleepy. So I had a sleepy baby on the other side. So I felt like I had the place to myself really. So I was quite lucky. But either way, I think even if you have got screamy babies and stuff, I don't think it's as bad as you might picture the postnatal ward. What was difficult was the night staff. They're understaffed and underpaid, and it's a shitty job. So they weren't amazing. I think they did the best they could. Like, you'd ring your bell to say like, I need some help, and someone might show up within 5 to 10 minutes. So like, some of the time he was grizzling to be fed. And I literally just had major abdominal surgery, and I was like, oh, I'm not supposed to get him out the cot myself. So I'd ring this, and then by the time they got here, he'd be like a bit ragey, which is fair enough. I mean, if I have to wait 10 minutes for my food, I'm pretty ragey. So that was annoying, and like nappy changes and stuff. And in the end, I just ended up doing it myself and just dealing with the pain. So that was a bit bad. Probably shouldn't have, but I just did a lot of stuff myself. And you have to get in and out of bed as well. You have to go and empty your own catheter. They want you to get walking as soon as possible. So that's good that you get walking. But I remember it feeling very scary to go from my bed to the toilet, which was about a minute walk away, if that, like 30 seconds walk. But that was scary and shuffly and scary. Because I've been so thirsty as well. So at first you're allowed to take like a sip of water and check that you're not sick. And then if you're not sick, they let you kind of drink as much as you want. And I was like piling this water down. So the catheter was just filling up within like an hour. And I was like, oh, there we go again. I've got to go empty this again. I remember just being like, oh no, I have to get up again. And getting in and out of bed is tough. Just the beginning. I'm going to say more positive stuff later. This is a positive birth story. It was nice to sort of message friends and family. I went to sleep for a little bit while Alex watched Vinny and had some skin to skin with him and just had some nice time. We messaged people. It was all very exciting. And then Alex leaving wasn't as traumatic as I thought it was going to be. For anyone that is having a baby during COVID, I thought I would be like crying as he left, but I hadn't rung any of my family yet. So, I'd saved that. So I rang my dad as soon as Alex left, and I was like, I don't know if you get this kind of out of body experience, but I was like, no, I've got this. I can cope. I'm going to be fine with this tiny, tiny child that I don't know how to look after and this massive wound across my stomach. And I think it was more traumatic for Alex leaving than it was for me, actually, because this huge thing had happened. In fact, do you want to come in and say how you felt about it? Because you said about like driving home and just being on the road and being like, no one knows that my life has changed. Do you want to come and say? Let's get Daddy involved. You can see what Daddy looked like when he was young and handsome. Here he is.
Hello.
With his comedy t-shirt on especially. He wears this a disturbing amount.
So I'll be brief. Yes, leaving the hospital was quite weird because like instinctively you just want to be with your new family. But it's very strange driving back, and I kind of took the advice of a friend, which was like, have a beer and an early night, because that's like the last time you're going to be doing that for a while. So went back, recharged the batteries, and then in like super early the next day to take over.
And then I just messaged you all night tonight. I was quite selfish. What would have been good actually would have been to have let him sleep so that he was fresh and ready for us to come home, but I kept him awake all night and just messaged consistently. Did I call you as well? Maybe a couple of times. Anyway, I did message throughout the whole night. I was like, he's just done a cute little noise. And Alex was like, good to know. It's 3 a.m. Anyway, but that was nice. I wanted to feel like Alex was there, so I messaged all through the night. Yeah, so the pain relief stuff. I wasn't really sure, I don't know if this is useful for people, but I wasn't sure whether you were supposed to request it, or how often you were supposed to take it, or if they were going to bring it to you. That was a bit mixed, and through the night in particular, there was a point where I think I'd got her in to come and help me get him out of the cot, and then I was like, when am I supposed to have pain relief? And then the next thing I knew, she turned up with pain relief, and I was like, oh, I wasn't requesting it, like I feel fine, but is there a certain time that I'm supposed to have it? And that never really became clear. During the day, they just seemed to sort of show up and bring me pain. They would say, would you like pain relief? Which I was told by everyone, don't be a hero, just take the pain relief, because that's gonna make you be able to move your body, and the more you move your body, the quicker you're gonna recover. And I was game for a quick recovery. So I was like, yeah, cool, I'm gonna do what the doctor says and take the pain relief. But they did ask, do you want some pain relief? So my advice would be, yes, just take it. And they come around during the day, but at night they didn't. So I don't know if you should request it every 3 or 4 hours or something. That was a bit vague for me, but I didn't feel pain. I didn't sleep a wink. I just stared at him all night. And this probably was the case. Well, who am I kidding? It's still the case now. I still stare at him all night, really. A month in, so I'm constantly looking. Is he breathing? And he was just so beautiful. I just look at his tiny, tiny little face, being like, I made you. That's so weird. We made him. Weird. So that was odd, and I just stared at him all night, just checking his breathing, and he was still definitely mine and still definitely here. And then Dad came back the next morning. Oh, I would say before. Oh wait, no, just a little burpee from you. Well done. Sticky burpee, I think. Oh, hello. There will definitely be a stage, like a certain age, where I stop congratulating on releasing gas. At the moment, I'm like, woohoo, well done, baby, you made some gas. Yes, I would say that if you're having a baby during COVID, and you can't have daddy stay, or whoever your birth partner is, make sure that your drinks and snacks are all within arm's reach. We did this, and then I knocked the bag over. So my snacks, I couldn't reach them. It was so traumatic. To be fair, actually, we did have 2 snack bags. We had like a cool bag and a non-cool bag. And the non-cool bag had like all the chocolate and stuff in, and the cool bag had like the fruit. I could reach the cool bag, which was very upsetting. So I did have snacks, and I did keep eating through the night, because you're awake, like you're going to be awake. But I didn't have the bad snacks, which I really wanted, so that was disappointing. Okay, so Dad came back. There was lots of visits and checks from various people. I probably won't remember them all, but I remember there being a women's health physio, several different midwives, volunteer breastfeeding, nurses coming in to take catheters out and do bloods. They do bloods again to check your iron levels. Some more bloods, I'm afraid. I wanted to know how many bloods there were, because I hate having my blood taken. The surgeon dropped in. I don't think that's even something he has to do. He was just a nice guy. Vinny had various checks. He had a general check. He had a hearing test check. So from the morning onwards, it was all go, 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 and you felt really looked after and stuff. So if you can get through that night where you feel a bit vulnerable and a bit alone, I was on cloud 9. I didn't really mind, but I could imagine if you're feeling a little bit sorry for yourself, or if anything's gone a bit awry, or you're just feeling in a vulnerable place, then that night feels a bit long. But the day was brilliant. We just had people popping in the whole time. It was amazing. I tried my first shower, and I was like, oh, I really felt like I'd like a shower. Again, TMI, tricky, because you can't really bend over properly. We certainly feel very wary of bending down at all. So Alex had to come in with me, which my baby had to come in with me. So we had a big family shower. Then we wheeled baby into the shower room, and Alex kind of had to hose me down. I've never felt quite so unattractive, because I was really swollen by that point. My legs were like elephantitis legs. I got really, really, really swollen. I think everybody does, but for some reason I just hated it. I just felt disgusting. And yeah, he had just sort of hosed me down and very, very gently sort of washed me. So that was fairly humiliating. We're not the kind of couple that even pee in front of each other, so I just found that like awful. But it was fine. And then he had to help me put like my massive pants on. You need massive pants that don't go anywhere near the scar, obviously. So I had these huge Bridget Jones pants. And that was the death of our sex life. Paranoid about the right hand side being really painful. So if I forgot, because you just sort of forget, you've got all these drugs floating around, it's very numb, the scar. And you forget that you've had this major surgery every now and then, and you go to just sit up like a normal thing you would do. And oh, hello. Are we going to need to stop the video to entertain you? Or are you just having a little fidget? Oh my gosh, I wish you could see the angle that I can see. He's going, ooh, ooh. You're so expressive. He's fast asleep going, ooh. Okay, yes, so I didn't have pain across the scar. I had sharp pain when I moved anything in my abs, just on the right hand side, and I was convinced that something was wrong inside. So we had a little look at before I left, the midwife had a look and said no, it's fine. And then I was worried about it. Every sort of midwife appointment, health visitor appointment, I'd bring it up because I was worried about this right hand side, which was like shooting pain whenever I used my abdomen. I forgot to use my arms to push me up. So I didn't use this, it was recommended by someone on a video, like one of these kind of girdle things, like a wrap that you wear around you that's supposed to hold you all in place. I didn't use one of them because I didn't want anything near that scar, but maybe that would just draw more attention to your abdominal area, so you don't try and sit up in bed or on the couch or whatever else, because I just kept doing it. I kept trying, going to sit up and being like, ah, and that would hurt. Instead of using my arms to push myself up. And I was really paranoid about that, and actually it was nothing. It was to do with where they tied a knot, I think, and just that side was more vulnerable than the other, more sort of sensitive than the other side. So it was nothing. So if you get that, you get pain on one side and not across the whole thing, it's normal. So postpartum, I was really apprehensive about, and actually it went so quick. So this is a month in, and you can see I'm perfectly mobile, to the point where I find it ridiculous that I can't drive, and I feel like I want to start running again, but I'm not supposed to until 12 weeks, which seems ridiculous. I feel completely myself again, including weight loss, if that concerns you. I was concerned about it. I hated being big. I kind of loved being pregnant, but I did not like being big at all. And I'm now probably about 2 kilos, if that, maybe 1.5 kilos heavier than my pre-pregnancy weight. And I think most of that is boobs, to be honest. Wow. Finally got boobs for the first time in my life. It's bloody brilliant. Thanks, Vinny. So yeah, I would say literally day 1, 2, 3 was I was a bit sensitive and a bit cautious. But by day 4, I started to feel like myself again. Really, really did. I almost wish I'd filmed this a week later, because you'd see that I was sitting normally and moving around. Honestly, within a week, I was sitting cross-legged, and I was, up and doing the washing and whatever else. Within a week, definitely within a week, but really mobile and normal within 4 days. We went for our first walk on day 3, and I felt a bit tired after that, but I was essentially fine. They don't let you leave hospital until you've passed urine, which was kind of amusing, because I passed a lot of urine because I'd been so thirsty that I just drank and drank and drank. I just drank gallons, and I literally did buckets of urine for them. I was like, "Here's my urine." They're like, "Thanks." I passed it. Gallons of the stuff, and then I was a bit bunged up for a few days, and that worried me, because you don't want to have to strain at all. So they administered us Lactulose, but we'd actually bought some as well anyway, so in case your hospital doesn't administer it, I don't know if all of them do as a standard thing, you might want to get some of that to have at home. It's still softener, and I kept using that for 2 weeks because I was paranoid about ever having to strain. So I was saying about painful gas. I didn't get this actually, but I'd taken Deflitine just in case. So I just took that for the first few days just to make sure that didn't happen to me. But I know that I know some of my friends have had horrible experiences with C-section, having this really painful gas that goes right up into your shoulder, and it's really debilitating. It's worth having a drug schedule. Make sure, as I said before, don't be a hero. Take your painkillers painkillers because they're actually going to really help you heal. So I left that to my husband. You could do it yourself or your birth partner help you, and just have a timer and say, right, it's drug time, and make sure you take those for however long. I took them for maybe about 10 days. I took painkillers and kind of weaned myself off. I had anti-clotting injections. Oh, these were awful. I don't know if this is because I'm over 35. They asked my age, so I'm 35. They asked my age, so I don't know if that comes into it. But Alex had to, you could do it yourself if you're hardcore, but I was not. Alex had to administer this jab into my kind of ass and thigh every night for 10 days, and that was horrific. Actually, it really sucked. Like, I don't like having jabs. I felt like I'd already given birth and done it all, and I just wanted that to be over. Like, it didn't hurt, it just sucked, it just sucked. So if you have to have that, that sucks. I'm just going to tell you that. Yeah, but it's 10 days, and in the grand scheme of things, I've forgotten all about it now, really. It's only because I've written it on this piece of paper. For the swelling, so I was massive afterwards. Not all of me, actually. I've heard some women can have a big face and arms and everything. It was just my legs, but they were huge. So I had a few things I did, whether they helped or not, but again, I wanted to feel like I was taking control of the situation. So I had peppermint oil, pure peppermint oil. They say to take peppermint tea, but if you take peppermint oil and put a few drops in your water, actually it's really refreshing. And I had that in hospital as well. I had that from the get-go. And it's supposed to have like 10 times the amount of peppermint in as a cup of tea would. So go hard or go home and go with that. And I was getting through loads of that. I would say the swelling went down certainly within 48 hours. So at the time I was like, oh my God, what's going on with me? But it did go down really quick, so don't worry about that. Always have water nearby you. Oh yeah, that's the big one. So they say you're supposed to drink those, but it's not even just that. You do not want to have to cough or sneeze. That hurts. It hurts, actually, yeah. So make sure you've always got water. So if you feel a tickle, like you might cough, get that water down you to try and stop yourself coughing. Like, do anything you can not to cough. If you are going to have to cough or sneeze, or as well as getting in and out of bed and stuff, you can actually hold the scarf quite firmly. You can push down on it quite firmly, and that really helps. So you've got your dressing on for quite a while and stuff, and even afterwards you can push on it, and that just takes the edge off if you do need to cough or whatever. Was having snacks in the bed for the early days, not in the bed, but by your bed. I found that those night feeds, if I had trash TV and snacks, and I'm still doing it now, I'm actually not too bothered about getting up in the middle of the night. Like, ooh, snack time, And it's fine, like, having like favourite snacks or just fruit or something if you're trying to be good. And just having a little something in the middle of the night. I tried for the first couple of days, I was trying to do like no blue light, and we're not going to talk to each other in the night, so that Vinny starts to learn the difference between night and day. And I think I managed like literally a day or two of listening to an audiobook, and then I realised that audiobooks definitely send you to sleep, and trying to feed a baby while sleeping is not a good thing. It's very dangerous. So I went straight in with trash TV, like it needs to be proper crap. Because you can't focus on anything decent with a plot line or anything at that, at 3 a.m. It's got to be utter crap. So that would be my advice for night feeds. A couple of other COVID-y type things. A lot of our appointments had to be phone call rather than in person, which sucked a lot. So we bought baby scales, which was really reassuring, so we could keep an eye on what was going on with his weight. So if you're about to have a baby, I would recommend that. A couple of our friends borrowed them as well. Which they had bought them themselves. Lactation consultant by the time we had Vinny, so Vinny was born a month ago, so 22nd of July, and by that point in the COVID journey, lactation consultants were coming to the house. Because ours was a planned C-section, we actually booked one for day 3. Thank God we did, because that was the day my milk came in and I got really engorged on one side. It was really, really horrid, and she really helped me out and then got us on a little schedule of sort of pumping and just getting myself evened out and back to normal. Then I ended up with really lopsided boobs as well. I found really traumatic. I got really upset about that on sort of, I don't know, maybe day 5, I think. One was way bigger than the other, and you have to pump on the one, or just always primarily feed on the one that's weaker to boost that one up and give the other one the message that it doesn't need to make as much. So if you end up with lopsided boobies and you're really vain like me, then that's my advice. That's sort of has finally evened them out. It took a little bit longer than I wanted. It took me about a week to get them evened out. I got really funny about having my stitches taken out. I was worried about that. It depends what kind of C-section you have. Like 3 of us in my group had C-sections, well 4 actually. One was an emergency, but 3 of us had planned C-sections. We talked about it a lot between us, and we all seem to have different types of stitches. So mine was like a like a sort of weavy thing throughout, and then I had a bead on each end. So I wish I should have looked up what that's called, but for mine, I think a lot of people have dissolvable stitches, and then you don't have to go in and have anything done with them, they just disappear. I had some dissolvable, and then I had this weavy thing. And I got really funny about having taken it out. I got really worried about it and had to take it was absolutely fine. So it was just a bit, again, a bit like weird. So they take the beads off the end and then they just put it through. So you're so numb, you can't really feel much, but I just sort of feel it going, woo, 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 woo. But it didn't hurt in any way. I thought having stitches out was something that was going to be painful, but it totally wasn't. Just a bit weird. Vinny had a tongue tie, so we had to get that done. It was like a 90th percentile one or whatever, like you could really see it, which luckily he could latch and feed, but we got it done pretty early. I think we got that done on day 5 or something, and it's not nearly as traumatic as you might think. You're like, oh my god, my baby's going under the knife, but she was amazing. She was a lactation consultant as well. She came to our house, we didn't have to take him in anywhere, and it's a really quick snip, like 2 seconds, bit of cotton wool to stop the bleeding, again 2 seconds, pop him on the boob, happy as Larry. He must have cried for a maximum of about 5 seconds, honestly. It was absolutely fine. The only like slightly difficult bit is we do have to kind of hold them down and stop them wiggling, which you know, you don't want to hold your baby down while he's about to be snipped, but it was over so quickly, so just don't worry about it if your baby has a tongue tie. Heel prick test you get on, was that day 5 as well? Day 5, yeah. He had that, yes, because he had it the same day as his tongue tie. Poor little guy, what a rough day. That's not nearly as traumatic as you think it would be either. It's a very similar idea. You know, it's a little cut that they make on his heel. He screamed for 5 seconds of that, and then we popped him in the boob and he was perfectly happy. Just plug on. So that's not anything to get yourself worried about. And then last thing I'm just going to finish off with is just recommendations for things that I had along the way that really helped me. A couple of books and podcasts and stuff, because I'm a big believer in knowledge is power, and hopefully you can go forward feeling really confident having your baby if you're watching this. And Vinny, you can know that Mummy was very, very organised, because she likes organised fun. So does Daddy. That's what we have in common if you end up watching this when you are grown up. So yes, books and podcasts. In fact, I'll get my hubby back involved with this. Honey, come and help recommend which things we really thought were great. I think in the pregnancy, definitely the pregnancy podcast. Just a lovely American lady called Vanessa was brilliant. That was really informative. Come and sit and remind me which things we listened to and read. What else did we think was good?
What to expect when you're expecting.
That was good.
Quite good.
Well, the movie was very funny as well.
Yes.
Quite different, unrelated, but watch the movie too, because that's amusing. But yeah, what to expect when you're expecting was good. I read it in a slightly funny way, so it's kind of got the week by week thing, and then it's got a load of really useful stuff afterwards at the end. So do skip ahead to the end, read all the useful stuff that you would need to know, and then do the week by week. It's written in a slightly weird way. What else? Anything else that was useful? I liked the, I think it's called the Birth Hour podcast, which is more positive birth stories. So if you're into that and you're watching this because you looked up positive birth story, I recommend that. Any other books? We now like the week by week.
Yeah.
Who's that by? We've got it there. Simone, I've got my eyes bad. Simone Cave.
Yeah.
Your Baby Week by Week. It's good. A little summary of what's going on with him now. Any others that we had in the lead up that would be useful?
Those are the main ones.
You don't want to overread.
Yeah.
That was what the advice of some of my friends is. You don't actually have to have even a degree to write a book. It's kind of people's opinions. So just be careful about how much you read, because it can be quite overwhelming and a bit misleading as well. You can end up being led down the garden path. And like, for example, a couple of things. I was really anti-C-section. Where did that come from? I had an amazing experience. It was brilliant. So that's ridiculous. And the other one, I remember saying to you when we were kind of learning to breastfeed, me and Vinny, being like, I don't know where it's come from, but if I had to get a bottle of formula out in public in a cafe, I'd be really ashamed. What is that about? Like, pre-birth, I would never notice if someone was giving their baby formula. I would not think anything of that. That's so fucked up. So some sort of indoctrination came somewhere along the line. So just be careful about over-reading stuff. During COVID, I wasn't really gigging at all. That stopped, and I was doing a small amount of teaching. I had far too much time on my hands, and I read a lot, and I think that can be detrimental. So those are the few that I recommend. I'll put links to them maybe in the thing below, so you get to them. And then I think that's it, Vinny. that's your birth story. That's how mummy got you out. And it's weird to think that he's heavier, but he's not actually that much bigger, like lengthwise, than he was when he was born. Like, he's just fattening out. That was in me. He's massive. So he was 3.5 kilos when he was born, 3.6. So not even a big baby, but just to think that was wedged in, it must have been so uncomfortable. That's his little send off. Should we bring him a bit close to the screen? This is Vinny. Oh! Sorry, buddy. Okay, we'll just we'll stop there. Peace and love. Thanks for watching.